An insulin pump is an external device that you wear on your body that takes the place of your pancreas. People that wear an insulin pump are either not producing enough insulin, or the body can't use it well, or they don't produce any insulin at all. This takes the place of shots. So you wear it on the outside of your body, and then you attach it to your body with a cord and then a cannula. This is a rubber cannula that goes underneath your skin. It's actually a plastic cannula, and it's very small, and you change it out every 3 days. The insulin goes into a syringe inside the pump, right here. You fill it up, and then you put it in, and it starts delivering insulin. It delivers insulin 24 hours a day, 7 days a week, and that's called a basal rate. And it's something that your body would use just if you were sitting down, if you were sleeping, that's how much insulin your body would use. Then you also get a bolus of insulin. And the bolus is what you take with meals or if you have a high blood sugar. And you program that into the pump. Pumps actually take into consideration what your blood sugar is right now. Then they take into consideration your insulin to carbohydrate ratio, which is how much insulin you would need for the amount of carbohydrates that you're eating. Then they take into consideration how long the insulin lasts in your system, and then what your target blood sugar is. And we can set that different for different times a day. So it's really good. It's a very smart pump. All pumps are smart, and they take all that into consideration, and it really makes life a lot easier for the person that has to take insulin. When you use an insulin pump, you wear it 24 hours a day, 7 days a week. You take it off when you take a bath. You also take it off when you go swimming, because most pumps are warranted and they're waterproof, but they're not guaranteed against losing them in a pool or in a lake or something. So we recommend taking them off. You can take your pump off for up to an hour a day or an hour at a time without having to take extra insulin. If you're going to keep it off for, say, 2 hours, you might give yourself a bolus for those 2 hours, which would be just additional insulin to cover yourself for the 2 hours that it's off. You want to make sure that when you put your insulin pump on that you clean your site, which is where this goes in. You clean it with alcohol to keep it clean, and that you change it out every 2 to 3 days. There are 6 different pumps on the market, and they basically all do the same thing. They all deliver insulin. They're all smart pumps, so they take into consideration your blood sugar, and your insulin to carbohydrate ratio and how long insulin lasts in your system, and your target blood sugar. So they all pretty much do the same thing. Some of them are more tech savvy, some of them are easier to use, and some of them are more resilient to where they don't break as easily, which is, an important factor for a lot of people. You need to figure out what's most important to you. And the way to do that is either to contact the individual insulin pump companies, and they'll give you all the information you need, or go on their websites and look for yourself and then decide what you need. Most people love wearing an insulin pump. It gives them freedom, it gives them flexibility. You don't have to eat at the same time every day, because the long-acting insulin and the short-acting insulins even require that you eat fairly frequently so that you can keep your blood sugar up, and you kind of feed the insulin. When you're wearing an insulin pump, you're not feeding the insulin, you're actually letting your body eat when it needs to, and then you take insulin for that. So it's a much easier way. It's better to control your weight, and it gives you much more flexibility in your life. Insulin shots are, they're good. I mean, insulin is great, because insulin, when it came around, really gave people a lot more flexibility in what they could eat. However, insulin is a growth hormone. So the more insulin you take, the more likely you are to gain weight. But the other side of that is if you take the insulin and you don't eat, you might have a low blood sugar. So then you have to eat to take care of that low blood sugar. Low blood sugars are very scary. If you've ever had one, it's very scary, and it disrupts your whole day. And then you're afraid you're going to have another one to begin with, so you eat more. With an insulin pump, we can take away the fear of having a low blood sugar by adjusting the basal rates, the different basal rates that are in there. We can do up to 48 different basal rates in a day. Now, we usually don't do that. Most people are on 3 or maybe 4 different basal rates. But because we can do that, we reduce the low blood sugars, so you don't have that fear anymore, and so you don't have to eat. We actually reduce the amount of insulin that you take on an insulin pump by 25%. So when somebody starts on an insulin pump, they're immediately taking less insulin, and then we can usually even reduce it even more, especially if the patient starts losing weight.